Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for your upcoming nursing competitive exams. You all know that in our YouTube Metier channel, we are posting important topics as well as important MCQ for the competitive exams. So kindly subscribe and follow our channel so that you will get to know about the upcoming exams and how to apply and how to study and motivational videos as well as important topics and questions we will discuss. Okay, so kindly subscribe and follow us. Okay, today we are going to see the important MCQs. Before that, we'll start with a small quote. You are the creator of your own destiny. Nobody create your destiny. You have to create your destiny. Okay, நீங்க எந்த இடத்தை அடைய போறீங்கன்னு நீங்க தான் முடிவு பண்ணணும். வேற யாரும் முடிவு பண்ணக்கூடாது. நீங்க தான் அதை கிரியேட் பண்ணணும். ஓகே, அது எப்படி கிரியேட் பண்ணணும்? உங்களோட ஹார்ட் ஒர்க்ஸ். ஓகே, ஸோ யூ ஆர் த கிரியேட்டர் ஆஃப் யுவர் ஓன் டெஸ்டினி. ஓகே, டுடே we are going to see about nursing ethics. Very important topic because so many exams, at least one or two questions will be which related to the nursing ethics. Okay, we are going to see about nursing ethics questions. First question, which of the following is not an intentional thought? Options: taking a patient's pain medication, assault, fall imprisonment, defamation. This is also previous year's question papers, important question. So the correct option is taking a patient pain medication. Option A is a correct answer. What is meant by tort? Torts are wrongful acts that causes someone to suffer harm. Okay, it's a wrongful act. Because of that act, somebody, for in our nursing, the patient is getting affected. Okay, because of our, as a nurse, if we are doing anything intentionally or unintentionally, okay, that will affect the patient. Okay, either it's a physically or mentally, it is called a tort. We can divide this tort into two types. Okay, it divided into intentional tort and unintentional tort. Voluntarily, willingly, you are harming the patient. That is intentional. Without knowingly you're doing, that is unintentional thoughts. Okay, we will see the further types of this intentional and unintentional thoughts. First, in intentional thoughts, we have assault. Assault means, you all know that assault means harming others physically. It is assault. What is meant by battery? Touching the patient without their permission, without their consent, it is called battery. Okay, then invasion of privacy. Okay, you are intruding into their patient's privacy. It is called invasion of privacy. That further divided into three types. Intrusion of solitude. What is that intrusion of solitude? Intrusion of solitude means spying about the patient and recording the patient's speech. These and all comes under intrusion of solitude. Okay, what is appropriation of name, identity and likeliness? Without the permission of the patient, you are using the patient name for your purpose. For example, one famous personality admitted in the ward. Okay, his name is X. Okay, we consider X. What you will do as a nurse, you are using the patient X name. You're telling that, hey, X is very close to me. Okay, whatever I say, X will do. Okay, like that, you are using the patient's name without their willingness. Okay, that is also invasion of privacy. Next, public disclosure of embracing facts. Without the patient permission, you are giving the patient information to the public. Okay, that is also invasion of privacy. So another thing is called defamation of character, either orally or written. That means you are spoiling the patient name verbally. It is slander. You are spoiling the patient by written. It is libel. Okay, very important. Go through this video again so that you can know about all this clarification about the the words assault, battery, invasion of privacy, defamation of the character, everything. Okay. So these are the intentional thoughts. What is unintentional thoughts? Negligence and malpractice. Unknowingly harming the patients. For example, you are connected to IV fluid, you forget it. Unknowingly, you forget it. It is also negligence, right? It is unintentional thoughts. Next is malpractice. You know that this is wrong, but still you are practicing. It is malpractice. Okay. You know that malpractice can harm the patient. Okay. Right. You are diluting the eptoin, 1 gram of eptoin within only in the 10 ml of NS. Definitely the patient will get harm. Okay. Unknowingly, if you are doing the wrong thing, it is malpractice. It is comes under unintentional thoughts. Miscellaneous thoughts also there. Nuisance, shouting to the patient, and the statutory laws. You're not following the laws of the nursing. So that comes in miscellaneous. That is not that much important. Intentional and unintentional thoughts are very, very important. Okay. So go through this video again so that it will be easily understandable, right? So according to this question, the correct option is option A, not assault, not false imprisonment, not defamation. You know, other options also I have explained. Okay. The correct option is taking a patient pain medication. Why it is comes under not an intentional thought? Because it's unknowingly you're doing, right? Unknowingly you're doing, either it's a malpractice, right? It's a malpractice. You should not take the patient's medications without their permission, right? So it is an unintentional thought, right? Other options are comes under intentional thoughts. Okay. Next question. A nurse stating that she loves working in long-term care because she likes the elderly population is an example of what? Values, dignity, respect, fidelity. So the correct option is option A, values. What is meant by value? Values are enduring beliefs or attitudes about the worth of a person, object, idea, or action. So don't get confused, nothing but, so I am a nurse. I have some beliefs and attitudes in me. So I am practicing that beliefs that if I am taking care of a particular population, I feel good. It is my value. Clear? So this is what this question is asking. The particular nurse would like to work in a long-term care because she likes the elderly population. It is the value of that particular nurse. Clear? So that is what meaning of the value. Okay. So what about dignity? What about respect? What about fidelity? We'll see. Dignity is nothing but you should treat the patient with the respect. That is called dignity. Okay. We should treat the patient with the respect. It is called dignity. Okay. What is meant by respect? Respect is nothing but we should value the individuality of each patient. For example, in one general ward, so many types of patients will be there. Their characters are different, right? Each individual is unique. We have to respect that. Clear? So that is one of the point. What is meant by fidelity? Very, very important. Fidelity is keeping one's promise or commitments. If you committed in a particular word, we have to follow that commitments properly. That is called fidelity, keeping the one promises, faithfully fulfilling the duty and obligations, right? That is fidelity. Clear? So according to this question, the correct answer is values. It is not dignity. It is not dignity. It is not respect. It is not fidelity. Okay. Yes. Next question. Nursing ethics is defined by what? Options: moral principles and values, written rules, policy and procedures, standards of care. The correct option is moral principle and values. What is moral principles? It is a basic ethics of the nursing, right? Nursing ethics is defined by moral principles and values because it involves making it ethical decision making. Okay. For example, autonomy. What is autonomy? Respecting the patient privacy and decision and beneficence, doing good to others, doing good to the patients, non-maleficence. What is that? We should not harm the patient, right? These are the basic ethics. So that is why the nursing ethics is defined by moral principles and values. These are all basics. What about other options? Written rules, policy and procedures, standards of care. It may change one hospital to another hospitals. The policy may change, the procedure may change, the standard of care may change, the written rules also may change. But the moral principles and values never change. That is why nursing ethics is based on moral principles and values. I hope you understand, right? Yes. So the option correct is option A. So next question, the Good Samaritan Act covers Samaritan, residents of long-term care facilities, passerby in car accidents, protection from civil liability when emergency care is provided in good faith, nurses who choose not to provide care in an emergency. So what is Good Samaritan Act? The correct option is option C. That means, for example, the Good Samaritan Act is what it is telling. For I am going on the way to the road. Okay, I'm on the road. Okay, I'm traveling. Some accident has happened. I'm immediately going and saving that particular person in an accident. So I am giving the emergency care or emergency help so that we can save that particular person. So what the Good Samaritan Act is telling that the person who helping, that means me, should not comes under any legal obligation, any legal problem towards me. I have to be safe. That is what this Good Samaritan Act is covering. Okay. Once I explain, or this means voluntarily help in an emergency situation, just such as providing CPR. Okay, whatever the first aid where I am providing, they cannot be held legally responsible for any harm. I am doing the CPR. After giving the CPR also, I couldn't revive that patient. But that is not my mistake, right? So I'm doing for a goodwill only, right? So I should not get any legal problems because of that act. That is called Good Samaritan Act. புரிஞ்சா? I will explain once again. நீங்க ஒருத்தங்க ஹெல்ப் பண்ண போறீங்க, உயிரை காப்பாத்துறதுக்கான ஃபர்ஸ்ட் எய்ட் கொடுத்துட்டு இருக்கீங்க இல்லையா? நீங்க கொடுக்கும் அந்த ஹெல்ப்னால அந்த பேஷண்ட்டுக்கு எந்த ஒரு ஹார்ம் வந்தாலும் நீங்க உங்களுக்கு உங்க மேல எந்த ஒரு லீகல் ப்ராப்ளம் வரக்கூடாது. அதுதான் குட் சமாரிட்டன் ஆக்ட். ஓகே, எஸ். அதர் ஆப்ஷன்ஸ் ஆர் நாட் கரெக்ட். த கரெக்ட் ஆப்ஷன் இஸ் ஆப்ஷன் சி. நெக்ஸ்ட், the nurse practice acts are example of what? Policy and procedure, statutory law, living wills, good nursing ethics. The correct option is statutory law. Statutory law means what? Then all the nursing practice, okay, that's are regulated by the particular law. It is called a statutory law. Either it's maybe a state level, okay, national level or international level. As a nurse, nursing practice, we have a statutory law. Okay, they will give the outline that how um, the scope of practice for nurses. They will setting the standards and the requirements, license and everything. That's everything comes under statutory law. It is not about policy and procedure. Policy and procedure is about the hospitals. The hospital will have the separate policy and procedure for the nurse. What is living wills? It is nothing but it's advanced directive. For example, I am the patient. In some conditions, because of chronic illness, in some particular point, I couldn't take a decision. So that I will give the advance directive to the particular person. This person will take a charge on me. He will decide about my care. Okay, that is living wills. It's another topic, advanced directive. Okay. It's not about the good nursing ethics. Okay, it is not comes under ethics because ethics we have seen already moral values, autonomy, beneficence, non-beneficence, that also comes under ethics. The nursing practice acts are the example of statutory law. Clear? I hope you understand. If you have any doubts, you can type it in the comment box. If you like, please press like button. Okay. Thank you all and meet you in the next class. Thank you so much.